Hello friend, today's topic is CSF. CSF or cerebrospinal fluid, it is a ultrafiltrate of plasma. It is present in both intracranial and spinal compartments. Now this CSF is secreted by choroid plexus, which is present in the ventricles of the brain. Now this CSF circulates in the subarachnoid space through various pathways. Now history. Firstly, Hippocrates described CSF as water surrounding the brain when he was describing congenital hydrocephalus. Galen referred this CSF as excremental fluid, as a waste, which was he believed that it was purged into the nose. The modern rediscovery of CSF was done by Emanuel Swedenborg, which described it as a spirituous lymph. Various other scientists were Francois Magendie, which contributed to role of CSF, Thomas Willis, Henrik Quincke, William Mastrate. Now, lastly, in 1940, William uh, Harvey W. Cushing said that CSF is secreted by choroid plexus. Now, development. As we know, the nervous tissue dwells from the ectoderm. Uh, now, the neural tube, which is formed by this ectoderm, it contains amniotic fluid, which communicates with the amniotic fluid of the embryo. Now, when this neural tube closes, the fluid is then secreted by choroid plexus, which is called CSF. Now, arachnoid villi develop around 35th week of development, and arachnoid granulation develop around 39th week of development. Now, this subcommissioner organ or SCO, which form resinous fiber, they are present in the intrauterine life, but they disappear during the early development. This is a diagram showing the development of the various CSF pathway. It shows LV, that is lateral ventricles, telencephalon, SCO, that is subcommissioner organ, RF, that is resinous fibers, which is present in the intrauterine life, and it helps in the circulation of the CSF. Now, this diagram shows the various stages of development of brain. As we see that the ventricular system initial present as a single tube-like structure, later differentiated into various ventricles, first, second, third, fourth. First and second combinedly called lateral ventricles, third ventricle and fourth ventricle. Now, circulation. CSF is produced by two lateral ventricles, and from these two lateral ventricles it passes to the third ventricle. The communication between lateral ventricle and third ventricle is called interventricular foramina, and the third ventricle is connected to fourth ventricle by a cerebral aqueduct. So these are communicating structures, various ventricles which contain CSF. From the fourth ventricle, the fluid passes into subarachnoid space by four openings. One is central canal in the spinal cord, median aperture, and the two lateral apertures. The CSF present within the subarachnoid space, which covers the brain, spinal cord, and stretches below the end of the spinal cord to sacrum. So CSF present from brain right up to sacrum. So CSF moves in a single direction in the ventricles, but in the subarachnoid space it moves in multi-direction. The movement of CSF is pulsatile, uh, which is due to pressure waves generated by the blood vessels by the beating heart. Now, this diagram shows the CSF system, which is CSF present in lateral ventricles, from where through interventricular foramina it goes to third ventricle, and from third ventricle, fourth ventricle, it passes through cerebral aqueduct. Then it passes into subarachnoid space. Now, this is a detailed view of the ventricular system. In lateral ventricle, there is a anterior horn of the lateral ventricle, posterior horn of the lateral ventricle, and inferior horn of the lateral ventricle. Uh, as we see in numeral 3 is the third ventricle, which is connected to lateral ventricle through interventricular foramina. Now the numeral 4 is the fourth ventricle, which is connected to third ventricle by cerebral aqueduct. Now contents of the CSF. CSF is derived from the blood plasma, so it is similar to it, and it contains approximately 0.3% of the plasma protein. So plasma proteins are very less in the CSF. approximately 50 to 40 milligram per deciliter. And CSF also contains higher chloride than plasma, whereas sodium is equivalent. Normally, in healthy individuals, CSF is free from the red blood cells, uh, and WBCs are also less than 5 per cubic mm. If a CSF contains more than 5 WBCs per cubic mm, this condition is called pleocytosis. Now, function of the CSF, uh, first is the CSF supports the brain. The actual mass of brain is 1400 to 1500 grams. However, due to CSF, net weight suspended is 25 to 50 grams. So it prevents the compression of the circulation, to prevent the compression of the arteries. Second is protection from the shock or trauma due to mechanical injury, prevention of brain ischemia, homeostasis. CSF allows regulation of distribution of substances between cells of the brain and neuroendocrine factors. To these, slight changes can cause problems, such as high glycine concentration can disrupt temperature and blood pressure control, and high CSF pH causes dizziness and syncope. Another function of CSF is clearing of the waste. Now, this CSF allows removal of the waste product from the brain, which is critical for brain's lymphatic system. And now, brain's lymphatic system is also called lymphatic system. So, when this goes away, CSF can be toxic, such as in amyotrophic lateral sclerosis. Now, production of CSF. Normally, brain contains 150 ml of the CSF. However, production per day is 500 ml. So CSF is circulated multiple times a day. It is produced at a rate of around 25 ml an hour. Now, weight-wise, CSF is present in higher amount in children. So infants have 4 ml per kg of the CSF, while children have CSF that is 3 ml per kg, whereas adults have 1.5 to 2 ml per kg of the CSF. So per body weight, infants have more CSF. So infants and children, they develop less post-dural puncture headache as compared to adults. So most CSF is produced by choroid plexus, and this choroid plexus is present in ventricular system except in the cerebral aqueduct and the frontal and occipital horns of the lateral ventricles. The production of CSF, it occurs in two steps. Firstly, the plasma moves from the fenestrated capillaries into choroid plexus. Into this fluid, filtered fluid gets collected in the interstitial space. In the interstitial space, the, uh, the water and carbon dioxide goes into epithelial cell, where the carbonic and anhydrase enzyme acts, and it converts the substances into bicarbonate and hydrogen ions, and which are exchanged for sodium and chloride. Now, sodium chloride and bicarbonate ions, they are actively secreted into ventricular lumen. Now, when it is secreted in ventricular lumen, there is a osmotic pressure which draws water. Now, chloride, which is a negative ion, also moves along the sodium to maintain electroneutrality. Now, potassium and bicarbonate are transported out of CSF. So, as a result, CSF contains higher amount of sodium and chloride, but less amount of potassium, calcium, glucose, and protein. Reabsorption. Now, CSF returns to vascular system by entering the dural venous sinuses via arachnoid granulations. Now, CSF, apart from these arachnoid granulations, CSF also drains uh, through lymphatic vessels, particularly around the olfactory nerve and nerve sheaths of various cranial and spinal nerves. Now, this diagram shows the uh, drainage of the CSM. CSF passes through the ventricular system to the subarachnoid space around the brain. From there, the arachnoid granulation, which are protrusion from the arachnoid matter, uh, it drains into the dural venous sinuses. So this is a homeostasis point of view. When CSF pressure is higher, there is less pressure difference between the CSF pressure and capillary blood pressure. So rate of production of CSF by choroid plexus decreases. From autonomic system point of view, the sympathetic nervous system increases the secretion of CSF, whereas parasympathetic system decreases the CSF production. The changes of the pH and various drugs can alter the formation of CSF, such as furosemide, which act on the sodium chloride transporter, can alter the production of CSF. This diagram shows the drainage of CSF. So in diagram A, when CSF pressure is normal, there is less drainage into venous sinuses. However, when pressure is raised, the arachnoid villi or arachnoid granulation, they enlarge, and it is secreted into the venous sinuses. Now CSF pressure is measured by lumbar puncture. It is 10 to 18 centimeter of water when lying down, while it is 20 to 30 centimeter when patient is sitting up. So now we will discuss various conditions related to CSF alteration. One is hydrocephalus, which is abnormal accumulation of CSF in the ventricles of brain, and hydrocephalus can occur because of obstruction to the passage of CSF. Now another condition is idiopathic intracranial hypertension. It is a idiopathic increase in the rise of CSF pressure. It is associated with headache, double vision, decreased vision, and swollen optic disc. It is associated with use of vitamin A, tetracycline antibiotics, and without any without any identifiable cause such as in women. Now, management of idiopathic intracranial hypertension is by carbonic anhydrase inhibitors such as acetazolamide, repeated drainage by lumbar puncture, or insertion of a shunt such as ventriculoperitoneal shunt. Now, CSF leak. Uh, CSF leak is a condition in which the CSF gets leak from this ventricular system or subarachnoid space as a result of physical trauma, lumbar puncture, or spontaneous. It is usually associated with intracranial hypotension. It can cause headache, which is made worse by standing, moving, or coughing, as low CSF pressure causes the brain to sag downwards and puts pressure on the lower structures. So when CSF is less in amount, the protective factor of the CSF on the brain structure is gone. So it can cause headaches. Another one is a test which can be used to detect that a fluid which is leaking is a CSF. That test is beta 2 transferrin test. When positive, it is highly specific and sensitive for detection of CSF leakage. Now, the imaging which can be done in form of CT scan or MRI, it can be used to detect the CSF leak. Treatment include injection of a person's blood into the epidural space, which is called epidural blood patch, spinal surgery, or fibrin glue. Now, another function is that some anesthetics or chemotherapy can be injected intrathecally into subarachnoid space where they spread around the CSF. So, some drugs are not given through blood but through CSF. Another point is baricity, which is a density of CSF compared with that substance, and it is used mainly in case of regional anesthesia to determine the manner in which particular drug that is injected into intrathecal space will spread. Now another topic is lumbar puncture. Lumbar puncture is performed either in sitting or lying down position. It is done to collect the CSF for either diagnostic purposes or therapeutic purposes. When it is used to done various tests, it is diagnostic, while if we remove the excess CSF, it is therapeutic lumbar puncture. It is done by 22 to 24 gauge spinal needle, which is inserted into L2, L3 or L3, L4 space. Now, when we insert the needle, there is a loss of resistance which suggests that we are in subarachnoid space. A manometer is used to measure the CSF pressure. Color of the CSF is noted whether it is clear or turbid or it is traumatic. And various samples are collected in 3 or 4 test tubes, 3 to 5 ml each. This diagram shows the procedure of lumbar puncture, in which spinal needle is inserted into L2, L3 space into subarachnoid space to collect the CSF. Now, indications for lumbar puncture. Indications are to rule out CNS infections such as meningitis, encephalitis, autoimmune conditions like Guillain-Barré syndrome, CNS vasculitis, subarachnoid hemorrhage, malignant cells, or therapeutic indications such as intracranial hypertension, communicating hydrocephalus, or cryptococcal meningitis. Another use of lumbar puncture is to deliver the various drugs directly into the CSF or delivery of some anti-neoplastic drugs. The contraindication of lumbar punctures, it is avoided in conditions such as non-communicating hydrocephalus, the patient has bleeding conditions, or patient is taking some anticoagulants, or if his platelet count is less than 20,000 per cubic mm, spinal canal stenosis or spinal cord compression above the level of puncture are also contraindications. Now, subarachnoid hemorrhage, uh, it's it is usually diagnosed by CT scan. However, when there is suspicion is high and we suspect as subarachnoid hemorrhage, lumbar puncture can be done, which is usually done about around 12 hours after the onset of symptoms, and presence of thousands cells, that is RBCs per cubic mm or xanthochromia suggest subarachnoid hemorrhage. Now, to now the blood in the CSF, it can be due to subarachnoid hemorrhage or it can be due to traumatic death. So we collect to differentiate these conditions. We collect CSF in three test tubes. If the consecutive tube shows decrease in the red blood cells, it usually indicates a traumatic death. Now, this diagram or table shows the various conditions for CSF analysis in case of infections. One is bacterial meningitis. In bacterial meningitis or encephalitis, there is decreased glucose and proteins are elevated, lactate level is raised, and WBCs are present uh, in thousands and mainly of neutrophilic. And gram stain can be positive and culture can be positive. There is also a raised CRP. In tubercular, the CSF is turbid, glucose is low, proteins are elevated, and cells are less than 500, mainly lymphocytic type. In viral meningitis, there is the fluid is clear and glucose is mildly decreased, protein is also mildly elevated, and cells are greater than 100 with mainly lymphocytic type. Fungal CSF is tested by clear fluid with low to normal glucose, mild increase in proteins, normal lactate, and 10 to 50 WBCs. Also, galactomannan can be positive in case of fungal meningitis. Aseptic meningitis, the picture is clear fluid with low glucose, elevated protein. However, lactate is are normal. Another condition is transverse myelitis. In this condition, there is CSF pleocytosis with oligoclonal bands, elevated IgG index, and elevated CSF IL-6 levels. Another condition is Guillain-Barré syndrome. In GBS, there is uh, cell count is normal, however, CSF protein are elevated. This condition is called cytoalbuminergic dissociation, which is suggested Guillain-Barré syndrome. The neoplasm of the in the CNS can be detected by CSF analysis, mainly in cases of primary CNS lymphoma. Now the patient can present with in this condition with raised ICT due to mass effect. In ALS, that is myotrophic sclerosis, there is MIR 218 depletion due to loss of motor neurons. Now the CSF antibody testing. Now from the routine, apart from the routine testing, some autoantibodies can be detected in CSF, which suggest autoimmune encephalitis. Some of them are NMDAR receptor antibody. It is present in autoimmune encephalitis, mainly in young girls with refractory seizures and psychiatric symptoms. And another one is LGL1, which is present in limbic encephalitis, GABA B, also present in limbic encephalitis, EMPA, Casper2. This antibody is present in CSF in case of Morgan syndrome. So this was about CSF. Thank you.